Hi there, it's Brother Ben, Bante Van Rakita Samanera. So today I'll be reading from Jenny Quek's book, The Buddha's Technique and Practice of Counselling, as depicted in the Pali Canon. So we're starting today at page 21. So just a reminder, I'm not claiming to be a fully qualified, licensed mental health clinician, and these readings do not count as substitute for counselling or therapy. If you are experiencing mental health issues, try to see a professional, fully trained counsellor or therapist. So I do hold a diploma obtained in Singapore for Buddhist psychotherapy and counselling. Okay, so let's continue with Buddha's social awareness. In contemporary books on sociology and social philosophy, the major concern is society. Sociologists and social philosophers study society as a whole rather than in terms of individuals. Since society is constituted of individuals, Buddha focused his attention on the individual, the Pugala, first, and then turned to society. Evidently, society is nothing but a community of separate individuals, whether large or small. A society is not an entity by itself. Individuals are the entities which constitute society. To visualize a society without individuals is something like imagining a melody without the notes. Besides monks and nuns who had left the household life for good, the Buddha rendered his services to lay male devotees, upasika, and lay female devotees, upasika, and an even wider circle of persons belonging to diverse social and religious backgrounds. It is quite clear that when he formulated his ethical norms, he always had man's relationship with the external world in mind. In other words, he viewed man as a social being, living in society, having interpersonal relationships. In fact, Buddhist ethics become meaningful only in the context of society. Particularly in counselling the laity, he was pertinent about the maintenance and the strengthening of familial, interpersonal, and social relations. This fact is shown in the following chapters. There is another way of looking at individual and society. Psychoanalytic theories of Freud, 1865 to 1939, suggest that individual and society are enemies. According to him, id, which is biological and driven by the pleasure principle, is aggressive and erotic, libido. The superego, representing the social norms and the moral values learned primarily from our parents and then society, is constantly at war with id. The third functional part of the mind, called ego, which acts on the reality principle, mediates in this conflict between id and superego and finds out socially acceptable means for the id to express its drives. Hence, the individual yields to society reluctantly and only out of compulsion. When we compare and contrast the Buddha's approach with that of Freud, we clearly see that there are both similarities and dissimilarities between the two. The Buddha's teachings aim at purging evil emotions, including latent tendencies, and eliminating their harmful effects by understanding, anubbodha, attention, manasikara, mindfulness, sati, presence of mind, sampajanya, and such other positive mental devices. But according to Freudian theory, the individual becomes humane and sociable reluctantly and only out of the compulsion of ego. In fact, Buddhist counselling is aimed at directing clients to self-actualization, the therapeutic goal of many of the techniques of psychotherapy. Carl Rogers, 1902 to 1987, in his person-centered therapy, postulated an innate striving for the goal of self-actualization. This is also what Karen Horney, 1885 to 1952, expected from her feminist therapy technique. The terminology of Buddhist psychoanalysis, Freud's contribution to psychology and allied subjects is immense as well as important. He tried to understand the workings of the human psyche from various angles and formulated new concepts. In order to express his concepts as a theory of psychoanalysis, he coined or borrowed some terms from Latin and defined them according to his new concepts. Other than expressions like pleasure principle, reality principle, the dynamic unconscious, resistance, transference, the conscious, the preconscious, unconscious, castration anxiety, the Oedipus complex, latency, such words like id, eros, thanatos, homeostasis, libido, cathexis, etc. have been used to convey his psychoanalytic theories. Terms used by the Buddha in his psychoanalysis, which is the basis of Buddhist counselling, are too many to mention here. Terms such as asaya, anusaya, sangyojana, nirvarana, satipatthana, and brahmavihara are some of them. Some of the terms have been borrowed from the current philosophy and psychology and Pali-sized, according to Pali phonetics. And by way of defining them, new meanings were imbibed into them, which Rhys Davids referred to as new wine in old bottles. Other than these, the Buddha himself has coined a vast number of terms. With the development of Abhidhamma, we come across more technical terms of Buddhist psychology. Later, the commentators also, by way of explaining some psychological situations, coined several more terms. In his Buddhist dictionary, Venerable Jnanatiloka has performed the laborious task of collecting these terms alphabetically and annotating them, while identifying the development of concepts in Abhidhamma and commentaries sequentially. The place of meditation in counselling. The connection between Buddhist psychotherapy, counselling, and meditation has been discussed and practiced in many a psychotherapy circle today. Although earlier psychotherapists considered meditation as a totally useless exercise, a new generation of psychotherapists and counsellors in Europe and in the States and other Western cultures has discovered its relative benefits for curing both physical and mental ailments. Stephen Batchelor put this trend thus: an area with one of the strongest links to Buddhism in Europe is that of psychology and psychotherapy. Buddhism is becoming the religion of choice for many therapists who either are Buddhists, have practiced Buddhist meditation, or incorporate Buddhist ideas into their work. The attraction of Buddhism lies not only in its analysis of human suffering, in terms of deep-seated psychological error and disturbance, but also its practical importance to dealing with them. That's from Stephen Batchelor's The Awakening of the West, page 364. Another writer, Gary Gatch, has confirmed this fact, stating unreservedly, historically, this rising popular interest in psychology and therapy led to much of the West's initial discovery of Buddhism. Psychology and Buddhism certainly influence and complement each other. It's worth comparing and contrasting the two. Both psychology and Buddhism are arts of being in the moment, of being in touch with one's own experience, with life as lived now, and realizing one's own potential for active awareness and a rewarding, meaningful, happy life. Recognizing the therapeutic value of Buddhist meditation, therapists use it widely nowadays, with or without the words Buddhist and meditation. Buddhist meditation is mind culture, and it can be correctly termed as a technique of culturing the mind. Some of the clients, as well as therapists, are reluctant to hear the words Buddhist and meditation due to religious and cultural feelings they cherish. Therefore, Gary Gatch suggests, sometimes the benefit of Buddhist techniques, such as mindfulness meditation, can become more easily and widely accepted when given a more generally descriptive name, such as stress reduction and emotional intelligence. Counselling, though it is a new discipline developed from psychotherapy, it is practiced very widely, and in its practice it embraces everyone from child to the old, irrespective of the person's profession and social status. Therefore, it is asserted that counselling is for all. One may need counselling at any stage of his life or her life. In this regard, how a simple technique like breathing mindfully is helpful for the success of one's daily career is highly appreciated in the counselling profession. Venerable Walpole Rahula, while describing meditation, focuses his attention on in-breathing and out-breathing meditation and says, apart from all this exercise on breathing gives you immediate results. It is good for your physical health, for relaxation, sound sleep, and for efficiency in your daily work. It makes you calm and tranquil, even at moments when you are nervous or excited. If you practice this for a couple of minutes, you will see for yourself that you become immediately quiet and at peace. You feel as if you have awakened after a good rest. It is to be noted that the fundamentals of Buddhist meditation in every Buddhist tradition are the same. Theravada can incorporate the methods of concentration meditation, samatha, and insight meditation, vipassana, as described in the Pali canonical teaching Into Therapy and Counselling. Vajrayana relies on its scriptures. It is well known that Pure Land teaching influenced the Nikon therapy. and Zen Buddhism, the Morita therapy in Japan. Counselling the living and the dying. Evidently, there is a doctrinal basis for Buddhist counselling. Buddhism maintains that we are the products of what we have been, and we will be the products of what we are. The effects of our retributive actions related to both good and evil follow us as long as we are in this cyclical existence. Because of this reason, Buddhism focuses its attention on both the living and the dying. The living has to understand the nature of life in the world and make it a better place to live happily for oneself and for others. The dying, on the other hand, learns to let go of negative emotional baggage and work on the unfinished businesses and coming to terms with it, so that one can prepare to die with dignity in anticipation of a better rebirth. It is imperative that Buddhists learn to let go, because according to the Buddha's teachings, one's last thought moment determines the next birth. Buddhist counselling covers both these aspects totally and exhaustively. This makes Buddhism an extraordinary religion among the religions of the world. The influence of mind over body. In philosophy, the causal relativity between mind and body is described under interaction theory, according to which the mind influences the body and vice versa. Philosophers argue in favor and against this theory, but we have the experience and the common knowledge that when there is fear, it induces sweat or heart palpitation or some other physical changes in the body. In some cases, all of these symptoms manifest together. Agony or grief results in inducing tears, heartache, headache, loss of appetite, or even constipation, or may manifest all of these symptoms together. Today, doctors have identified psychological factors underlying physical conditions, and they are called Psychophysiologic Disorders or psychosomatic disorders. A note: peptic ulcers, irritable bowel, ulcerative colitis, coronary artery disease, respiratory disorders. Regular meditation has been shown to boost the body's immune system. It controls high blood pressure and also prevents building up cholesterol plaques in arteries. It is said that magnetic resonance imaging, MRI, tracking blood flow and electrical activity have shown that meditation rewires the brain to reduce stress and depression. The Mahakassapa Bojjhanga, Maha Moggallana Thera Bojjhanga, Maha Chunda Thera Bojjhanga, and the Girimananda Sutta are the recorded instances of the influence of mind over body. When the Venerable Mahakassapa and Venerable Maha Moggallana were severely ill, the first two discourses were recited to them in order to assuage the painful feelings of those two disciples. The third was recited on the request of the Buddha, when the Buddha was not well, and the Girimananda Sutta was recited to cure the sickness of Venerable Girimananda on the request of the Buddha. In all of these instances, it is recorded that by listening to these recitations, the sickness of the Buddha and the other venerables abated. These incidents reveal the potency of the mind to wield its power over the body and cure physical sickness Most of the Buddhist discourses are considered as asseveration of truth, invoked to avert external evil influences, and particularly abate physical illnesses. In Counselling the Living, the Buddha's teachings aim at creating a harmonious balance of the body and the mind. Reluctantly, there emerges a healthy mind in a healthy body. The problem with most of us is that we are imprisoned in our own subjectivity, kindled by our own egocentricity. As long as there is this conceptual frame of mind, both physical and mental health recedes from us. Once a deity is said to have asked the Buddha, "Those who dwell deep in the forest, peacefully leading the holy life, eating but a single meal a day, why is their complexion so serene?" And the Buddha replied, "They do not sorrow over the past, nor do they hanker for the future. They maintain themselves with what is present. Hence their complexion is so serene. Through hankering for the future, through sorrowing over the past, fools dry up and wither away, like green reed cut down." From the Samyutta Nikaya 1, page 5, translated by Bhikkhu Bodhi. King Kosala also has observed this fact. In order to understand the impact of the mind over the body, it is worth elaborating here. In front of the Buddha, King Kosala said that he has seen some recluses and Brahmins who are lean, wretched, unsightly, jaundiced, with veins protruding from their limbs, and such that people would not want to look at them again. When he questioned them as to why they appear so, their reply was that they were suffering from a family disease. Contrasting this situation with what he has seen in the Buddhist monkhood, the king said, "But here I see monks smiling and cheerful, sincerely joyful, plainly delighting, with their faculties fresh, living at ease, unruffled, subsisting on what others give, abiding with mind as aloof as a wild deer's." In fact, in relation to the benefit of meditation, its benefits related to present life has been given in the scriptures. Because of the fact that the effect of Buddhist meditation on body has been clinically proven, psychotherapists and counselors are now integrating meditation into therapeutic practice. Counselling the living according to Buddhism serves two objectives. Firstly, the clients reap its benefit here and now, in this life. Secondly, in the next life as well. There are explanations of present psychosomatic conditions in relation to retributive action, karma, done in previous life. Among the many instances, the following are two instances. The first instance, a Brahmin student called Subha asked the Buddha why there were people who are inferior and superior, short-lived and long-lived, sickly and healthy, ugly and beautiful, uninfluential and influential, poor and wealthy, low-born and high-born, and foolish and wise. Buddha's reply can be summarized as follows. One who kills living beings, when born as a human, is short-lived. One who injures others, when born as a human, is sickly. One who is angry and irritable, when born as a human, is ugly. One who is envious, when born as a human, is uninfluential. One who does not give food, when born as a human, is poor. One who is obstinate and arrogant, when born as a human, is inferior born. Those who are devoid of these character traits are blessed with good effects of their wholesome conduct. Accordingly, the Buddha says, "Student, beings are owners of their karma, heirs of their karma, They originate from their karma and are bound to their karma. They have their karma as their refuge. It is karma that distinguishes beings as inferior and superior. The next instance is the story of Rohini. She is Venerable Anuruddha's sister. When the Venerable visited his family in Kapilavatu, all his close relatives came to see him and paid respect to him. But his sister refused to come and see him because at that time she was suffering from an acute form of skin eruption. But Venerable Anuruddha sent for her, and reluctantly she came with her face covered with a cloth. When she was questioned about her absence, she said that as she was suffering from a severe skin eruption, she was ashamed to come. Knowing her pathetic situation, he asked her to build an assembly hall for monks. When she said that she did not have sufficient resources to proceed, she was asked to sell her ornaments. She agreed, and Venerable Anuruddha himself supervised the work, and other relatives helped build the hall. At the dedication ceremony, she entertained the Buddha and the monks, but she was reluctant to come to the presence of the Buddha and the monks. At the conclusion of the ceremony, she was persuaded to come to the Buddha, and the Buddha revealed her previous karma, which resulted in the present skin disease. A long time ago, she was the chief queen consort of a king of Benares. There was also a dancing girl whom the king loved. The queen was jealous of her. She got some scabs, kachu, and asked the dancing girl to come to see her. Without being noticed by the girl, she contrived to sprinkle the powdered scabs on her bed and on her clothes. The girl developed boils on her body, and her skin was ruined. The Buddha revealed this past incident done by her out of jealousy. As a result of the dedication of the assembly hall for the monks' use, her skin eruption gradually healed. This story reminds of incidents recorded in the book Many Mansions by Gina Seminara. For some of the ailments caused due to misuse of body, word, and mind by his clients, the psychic Edgar Cayce also has prescribed this type of generous and philanthropic actions to be performed. Forthwith, their sicknesses are stated to have been cured. This is Bhante Van Rakita, Samanera, also known as Brother Ben. As I've explained, I am not a qualified, licensed counselor or mental health practitioner. I do have a qualification, which is a diploma in Buddhist psychotherapy and counselling attained at Singapore. This reading should not be taken as a substitute for counselling or professional therapy, and the credit for the work goes entirely to Jenny Quek for her excellent compilation of this book, The Buddha's Technique and Practice of Counselling as depicted in the Pali Canon. May many beings be freed from avoidable suffering.